From the Chinese University of Hong Kong. I joined CCOUC, so it's a disaster research center collaboration between the Chinese University of Hong Kong and Oxford University. So I work mainly in disaster research area at that time, and then I did a lot of doing on ethnic minority health project. Also developed the global health mobile app and conducted disaster first aid training in China. Then I returned to Jakarta in 2015 and did a lot of actually research project on health technology assessment, and then also did some community projects with the government and also the academic institutions, and also for the private companies. So I highlight these two projects, Hong Kong Healthy Living Project and Adolescents Health Project, which I will explain more later in this presentation. The first one is actually I did in Hong Kong, and the second one I did here in Jakarta. So you have a description about working on health project management with the NGO-based project in Hong Kong, and then the private company-based project in Jakarta. So the outline of my presentation would be the overview of the project, the program planning, team coordination, so it's like the whole management of the health project, timeline and job desk, financial management, monitoring and evaluation, collaboration, and also the challenges. So I'm very honored actually to be here and then to be with the other honorable speakers. And today I'll probably more on practical side, so probably more on the ground and see the experience, my experience, and I hope to share and I hope you can learn from it. So the first one is a Healthy Living Project in Hong Kong in 2013 or 2014. So just the overview of the project. So this is a project actually from a non-profit organization. It's an NGO-based project. The foundation of the organization is founded in Hong Kong in 2011. So it was originated as from the idea of a group of medical professionals, doctors, nurses, pharmacists, and they have concern on marginalized population. At that time, they were concerned on asylum seekers and refugees in Hong Kong. So actually, Hong Kong is more like a transit city, so they did not accept or they did not accept the refugees, but they have a UNHCR organization there that will be that decide whether the asylum seekers will receive where to go to the other countries. So Hong Kong is more like a transit city. But there are a lot of asylum seekers, mainly from African and South Asian countries. They came to Hong Kong and they were stranded there because most of them are actually tricked by their agency. So the agency asked them to pay some money to be able for them to go out from their own country because of the persecution in the country. But then they were left in Hong Kong because the agency, they were promised to go to US or to Australia, but then actually the agency left them there. So there were quite a number there. It's around 6,000 asylum seekers. It's a registered asylum seekers and refugees in 2012. But compared to the population in Hong Kong, it's only 7 million. So it's still less than population in Jakarta. So we have, at that time, had concern on marginalized population, especially in asylum seekers and refugees. So we try to identify the problem because this group of people, they don't have knowledge of the health system in Hong Kong. So usually they just go straight to the emergency service. So there's abuse of emergency service. They don't know how to go to the clinic or to the primary care service, which actually they only have like a simple kind of disease, but they just go straight to the emergency service. And they have poor relationship with the society because they have like a negative stigma about this group of people because they have different language, different culture. So, and then there's no NGO working for their health. So mainly the NGOs or churches there working as actually just to help them to provide them with food or shelter, but no one actually working for their health. So how we came up with the idea of the program. First, actually, this is like the second term the second phase of the project. So the first phase of the project is actually the community participation project. So we try to involve them with the local community. So they're actually helping the local people there, like they have a gathering together, singing together. So they try to introduce about their culture, they're sharing their experience or sharing their story with the local people. So it actually gained, this is like the interview, the result from the asylum seekers and refugees. They said that the activity made them stronger inside and outside because it gives them more confidence to talk with the local community. And then it gave them hope about future, and they understand that most of the people they serve, they didn't know who they are. But now, because of this activity, they gain more confidence, they know about the culture, they can share about their music, they can share about their culture as well. And then we try to do health needs assessment. So we did an in-depth interview with the asylum seekers. We also have discussion with other NGOs or the organization that actually help the asylum seekers. In Hong Kong, there's a lot of churches that actually work with the NGOs or helping the NGOs. So we have discussion and in-depth interview to see what actually they're helping. So we identified these 6 health gaps. General health, especially, is actually health-seeking behavior because they don't know what they should do if they're sick. And then dental health, family planning, access to health information resources, culturally appropriate health service environment. Because usually they come to the hospital, sometimes they were ignored because they were different, and sometimes they can't really speak English, fluent English. So the Hong Kong people treated them differently. And also mental health, because usually they have a background due to the conflict and persecution in the country. So I have some mental problems as well. So continuing from the previous presentation that mentioned that we actually built the program based on the log frame. So after we did the health need assessment, we tried to map their needs, and then we tried to look into the log frame, the logical framework, and make like the goals, the impact, and then the outcome, the output, and what we can do. So this is like the examples from this project. So we try to make 4 specific objections. Like the first one, the healthy living orientation. Our objective is to improve the access to health information and resources. So what we do in the activity, we make a series of booklet of healthy living orientation, and the booklet consists of how the asylum seekers can communicate with the health service provider. There's also a list of health services, how to access the information, and a guide of health tips in Hong Kong. And then we also do the health education. We organize a regular health education for the asylum seekers. And then we also provide the individual health advice session, only health advice session. So we still ask them to go to the clinic, to go to the primary care service. So this is just a health advice session. It will reduce the language and cultural barrier. So this is the example of the healthy living orientation booklet. This one, so we have a achieve your objective or not. So how is your progress? So this is, you have to adjust the timeline with your objectives and you know the target of the project. And then the financial management. So you know each month, because when I work in this NGO, we have a financial report every month. Actually, I also have a weekly report to the project manager. And we have a monthly report for the finance and also for the activity. So you have a lot of monitoring. So you know that you have to have a clear reporting system. And then for the finance management, you have to also understand, you have to talk with the financial manager, whether it's a reimbursement, so you did the activity first and then you get the reimbursement, or they will give you an amount of money and then you have to ask again before you do your activity. So this is the monitoring and evaluation. So we have like internal monitoring from the project manager, from the head of the organization, and also from the board meeting. But we also have external monitoring from the donor. So they will sometimes visit you and check your activity, whether it's aligned with the project or not, with the target or not. And then you also have a project evaluation. So sometimes we did the pre-test and post-test because we did health education. And then feedback questionnaires. We also have interview actually, the asylum seekers at the end of our project. And we develop the midterm and final report to the donor. Okay. So in this project, we also collaborate with other NGOs because we need to locate where is the asylum seekers, the pocket of the asylum seekers. So we talk with the NGO, the other NGO, and we also talk with the church that serves them. So we got the point of the asylum seekers, and we go into this pocket of asylum seekers to gain the target of our project. And then, so this is very important because without them, actually, we don't have that work to reach the asylum seekers because it's more like a marginalized. It's not general population. So you actually have to do face-to-face meeting with them because it's also gain trust because they actually lack trust and lack confidence. So you have to really come forward to them to reach them. Okay, so the next one is actually conducted in Jakarta. So we did the Adolescent Health Project in 2017. So it's actually based on a private company who was interested to participate in community project as part of their corporate social responsibility. I think it's very common in Jakarta. And the project aims to increase community awareness on adolescents' health. So in the private company project like this, usually you make a proposal and then you have to go for bidding because it's not from one institution. So there's a lot of institution bidding for the project. And then you develop the project. Before that, you do the program planning. So you discuss with them what actually their interests, what actually your interests, and whether it fits to your interests or not, and whether it's actually targeted and giving the benefit to the target people. So you have to know because they have agenda, they have interests, and you also have interests. But you want to focus whether it's actually the activity provide benefits to the community or not. So we also did the need assessment. So we did the literature review. We also did the focus group discussion with the teachers and then discussion with the local authorities. So this is what makes it different in here in Indonesia. Local authorities hold very important role. So whenever I did a project in Indonesia, I always have to know who are the local authorities. So I have to talk and collaborate with them. So this is the step-by-step of the project. So starting with the need assessment, and then we developed the module, and then afterward we did the health education in schools, and then also we did an evaluation. And we also, because our target later on is not only the students, but also the teachers and also the parents. So we try to hold the parenting seminar. So the objective here and our target, so we divided the targets into 3 parts: the students, the teachers, and the parents. And then the objectives for students is to improve the students' knowledge on health, and then we would like to increase the awareness of teachers and parents, and to promote the importance of health education among the adolescents. So the activities also follow the specific objective, and these are the indicators. So for example, to improve student knowledge, we have to have the module first. So in order to have the modules, we did the focus group discussion with the teachers. So we know the needs assessment. So based on the need assessment, was actually the students need to know about the health education and whether it's already implemented in the school or not. So we know what actually they received in the school, what actually happened, and then we try to build the module. And then we did the health education, and we also when we conducted the health education, we tried to talk and collaborate with the teachers and with the schools, because in Jakarta, the schools, they already have a strict curriculum, so and very tight schedule. So we try to talk with them to collaborate whether how can we fit the health education. So we cannot just do and come and then just talk to them about this and that without knowing whether they already receive it at school or not, whether it's actually meet their needs or not. So these are like the models that we developed, and these are the activities we did. This is we did a focus group discussion at schools, and also we did the collaboration with the district office, kecamatan, district office, and also with the sub-district dengan lurah-lurahnya as well. And also we did the health education here. Part of our module is also nutrition. So therefore we teach them about the piringku. Yeah, it's piringku. And then during the seminar parenting, we also give them the seminar for the parents. And also we did the seminar for the children as well, for the students, because we did the competition later on for evaluation. So we did the vlog competition, because for right now, I think the students more like a digital competition, like sort of that. So we did a vlog competition, but before that we give them training from the vlogger, how to do the vlogs, and then they come up with the idea combining what they have from the health education, and then trying to do it using vlog and make the vlog. So it's for the competition and also for our evaluation. So for the team coordination, it's different from the previous one. The previous one, you have the structure, you have the supervisor, you have the project manager. For this one, it's more like you got the project, you got the funding, and then you be like the leader or the PIC, and you have the team members. So you have to be clear on the job desk from the beginning, and you discuss with the team members whether it is feasible for them to do it or not, whether they can do it or not, whether they can manage it or not, and then you make the timeline. So you know, and if you are the leader or the team coordinator, so you know how to monitor the team member, the progress, and then whether they actually can do the job test or not. And then you do the monitoring and evaluation as well. So the plan and actual, whether they have different or not. If they have differences, why it can be happened. So you have to know and have like a report, because you also have to give the report to the donor as well. So the collaboration is still with like the schools here, and the important thing is actually the local authorities for doing project in Indonesia. So just to summarize about the challenges. So you have to understand this project, the target of this project, and who are the donors, who are the funders. Because they have different systems, they have different interests, and you have to negotiate whether it actually fits to your interests or not. Whether it's actually, because for you as from me as a researcher and from the academic institution, so I would like to know whether it's really benefit to the community or not. So you have to know the interests they have, and then prepare for plan B, plan C. So what I mean is actually, when you do the project, sometimes they change suddenly. For example, like they change the director. So the new director has different vision. So you have to understand, you have to negotiate again. And you have to see whether their vision is still the same as the plan, or they have a new idea. And if they have new idea, whether it actually fits or not. So that's why you have to prepare plan B, plan C. And sometimes there's a lot of plan you have to know. And then still here is the bureaucracy and administrative challenge. Always in here. There's a lot of bureaucracy. You have to ask for your supervisor, ask for the other person, you have to ask for the signature, and then so on. So this is actually brings a lot of challenges. And then internal coordination and collaboration with others are important. So you know, like Professor already mentioned, that you know the people, you know their talent, you know what they're best at, and you have to be best to coordinate them. So you know the people, you cannot work alone. So even though you know all the project yourself, but you have the people who will work with you. So you are not alone. And you cannot work alone. So you have to try to see whether who fits what. And then you collaborate with others. Because if you work alone, actually the project probably just targeted one target. But you cannot actually, you are able to reach more people. You are able to reach more targets. But if you just work in your scope, you don't know what other people or other organizations already did. Whether you repeat the activity or it's actually gain no benefit for them because they already receive benefit from other organizations. So you have to collaborate with others. And then the reporting system. So again, in doing project, reporting, and then finally is documentation. Documentation is always important. If it's not written, it's not exist. So you know that when you go, you do activity, you have to write down, you have to take pictures as your evidence. Otherwise, people won't know that it's actually happened. Okay, so I think this is the end of my presentation. Thank you for listening.